These 50 OBGYN questions have shown up on Didactic, EOR, and PANCE exam over and over. Today we will cover the high-yield info for most tested OBGYN topics, and the first question as is important as the last one. So let's begin. What is the most common cause of the first trimester bleeding? That would be the spontaneous abortion. Most questions in their stem will tell you that the patient is experiencing cramping and bleeding, and in that case you should suspect miscarriage. What is the most common cause of second trimester bleeding? That would be the placenta previa. This will manifest itself as a painless bleeding after 20 weeks. What is the most common cause of third trimester bleeding with pain? And that would be placental abruption. And memory hook, I always advise my students to come up with their own memory hooks to help them memorize the material better. And abruption to me equals abrupt pain. How do you differentiate placental previa from abruption? And you should focus on presentation. Is it painful or painless? Previa will be painless and abruption will be painful. Previa is peaceful, abruption is agony. Pain is a hallmark of multiple choice questions. So in a STEM, as you're reading, always pay attention if the pain is present. What is the gold standard for diagnosing ectopic pregnancy? And that would be the transvaginal ultrasound. So the memory hook for that for me was peek inside before she bleeds outside. Peek inside with the ultrasound before she bleeds outside in case you suspect ectopic pregnancy. And an exam tip, look for beta HCG not matching the ultrasound findings. What lab confirms pregnancy? And that would be beta HCG. Beta HCG for me equals as baby hormone calling. Rising levels double every 40 to 72 hours in early pregnancy. That itself can be another question. How often does the levels double in early pregnancy? And the answer is 48 to 72 hours. Beta HCG levels to visualize intrauterine pregnancy on transvaginal ultrasound. And this would be 1500 to 2000. And the way I remember this is double K, 2K to see the baby. So an exam tip, if you see the beta HCG is above 2000 and no intrauterine pregnancy, you should suspect ectopic pregnancy. What medication is used for stable ectopic pregnancy? And that would be methotrexate. Candidates must be hemodynamically stable and no rupture present in order to administer methotrexate. This is a good time to tell you that all these questions are coming from the PA OBGYN EOR study book, where there's 120 exam style questions and a complete content overview. So if you have a classmate that is going through OBGYN rotation, share this with them as they'll find it super helpful. It'll help them save time, study smarter, and spend more time with their loved ones. So let's continue. What are the contraindications to methotrexate? Well, that would be the ruptured ectopic pregnancy, as we already mentioned, renal and hepatic disease, or if the patient is breastfeeding. So rupture is a surgical emergency, and you should not give these patients methotrexate. Most common cause of postpartum hemorrhage, and that would be uterine atony. So check for boggy uterus on pelvic exam, as that would be indicative of uterine atony, and that is the most common cause of postpartum hemorrhage. What is the treatment for uterine atony? And that would be uterine massage and oxytocin as the next step in treatment. Rub and run the oxy. So the stepwise approach for treatment of uterine atony is massage, medication, and then if all that fails, surgical intervention. What is the most common postpartum infection? And that would be endometriosis. So memory hook, fever after baby, endometriosis is likely. Often post C-section, patient will present with fever and uterine tenderness. What is the treatment for endometriosis? Well, the treatment is clindamycin plus gentamicin. And the way I remember this is gentle clinda cleans the womb. Gentle for gentamicin, clinda for clindamycin cleans the womb. Include anaerobic coverage. What is the most common cause of maternal death worldwide? And that would be postpartum hemorrhage. What is the triad of preeclampsia? Hypertension, proteinuria, and edema after 20 weeks. The memory hook, 3 signs after halfway equals preeclampsia. And three signs are, again, hypertension, proteinuria, and edema. So an exam tip, edema is no longer required for diagnosis in the new guidelines. What is definitive treatment for preeclampsia? Well, that would be the delivery of the baby. What medication is used to prevent seizures in preeclampsia and eclampsia? They're going to give you 4 different medications in the exam answers, and you should look for magnesium sulfate. MAG stops the mind storm. So if you think about seizures, think about a mind storm in the pregnant ladies, and you should think about MAG stops the mind storm, magnesium sulfate. Exam tip, they may ask you how is this administered, and it's going to be loading dose followed by continuous infusion. What is the antidote for magnesium toxicity? That would be the calcium gluconate. So too much mag, call for calcium. Too much mag, call for calcium. Watch for decreased reflexes and respiratory depression, which will indicate magnesium toxicity. What is the definition of eclampsia? Well, that would be a seizure in a woman with preeclampsia. Preeclampsia plus seizure equals eclampsia. Often presents post 20 weeks of pregnancy, and seizures can be preceded with severe hypertension. HELP syndrome stands for what? Hemolysis, elevated liver enzymes, and low platelets. This may present with the right upper quadrant pain, and the labs is diagnostic key. So they may list 4 different findings and ask you which one of these is not part of the HELP syndrome, in which case you look for something that is not hemolysis, elevated liver enzymes, or low platelets. Most common cause of female infertility, and that would be the PCOS. Pearls and ovaries equals no baby. PCOS, I always think of pearls and ovaries, and I think these patients have a hard time getting pregnant. Look for anovulation and hyperandrogenism. Which hormonal imbalance is seen in PCOS? That would be increase in LH and decrease in FSH, which will lead to the increased androgens. On exam tip, you should look for LH to FSH ratio often bigger than 2 to 1. What is the first line treatment for PCOS? So they're going to list 4 different treatment options, and the answer is lifestyle changes combined with oral contraceptives. So the contraceptives are going to regulate the cycles and reduce androgen effects. Ovulation induction in PCOS, and that would be clomiphene citrate. First line, infertility is desired. So in the question stem, they're going to tell you the patient has PCOS and they're desiring pregnancy, and they're going to say, what should you prescribe to this patient? And that would be clomiphene citrate. First line treatment for gestational diabetes, and that would be diet and exercise. Check fasting at postprandial glucose, and you should be monitoring this weekly. So diet and exercise is a first line treatment for gestational diabetes. What is the drug of choice if diet fails in gestational diabetes? And that would be insulin. So the way I remember this, if sugar stays high, inject to comply. If sugar stays high, gestational diabetes, inject to comply. Oral hypoglycemics are often avoided in a first line treatment for pregnant patients. What is the definition of gestational hypertension? Well, that will be the blood pressure that is greater than 140/90 after 20 weeks of pregnancy without proteinuria. You should monitor closely, which can lead to progression to preeclampsia if not treated. What is the most common cause of early pregnancy loss? Well, this will be chromosomal abnormalities. So they're going to give you a question stem, and they're going to ask you what is the most common cause of early pregnancy loss, and the answer is chromosomal abnormalities. And the way I remember this, bad code, early unload. Bad code for chromosomal abnormalities, early unload for early pregnancy loss. This is going to be often very sporadic. Is going to recurrent losses may need karyotype testing. So that could be a question in itself. They're going to tell you this patient has had several pregnancy issues in the past, all leading to the loss of the baby, and they're going to ask you what's the next best test, and that case will be karyotype testing. What is the first line test for postmenopausal bleeding? And that would be again transvaginal ultrasound, which may show thickness greater than 4 millimeters, often warrants endometrial biopsy. So if there's postmenopausal bleeding, the test of choice is going to be transvaginal ultrasound, and if the thickness is greater than 4 millimeters, that may warrant biopsy. What is the gold standard for endometrial cancer diagnosis? And that would be the endometrial biopsy. So the memory hook to catch the cancer, take a sample, not a scan. So as with every other cancer, you cannot make that diagnosis off the scan alone. You're going to need a sample to make the diagnosis of the cancer. So office biopsy usually is sufficient, and a DNC if it's inconclusive. So the question stem can say, you suspect endometrial cancer, the biopsy was insufficient, what's the next best step in treatment? And that would be DNC. Which infection is causing strawberry cervix? And that would be Trichomonas vaginalis. And the memory hook for that I have is tricky trick makes the strawberry stick. Tricky trick makes the strawberry stick. Tricky trick should make you think of trichomonas and strawberry sticks. Exam tip, you're going to look for a vet mount that shows modal trichomons and then treat the partner, as that is a part of the treatment for anybody who is having trichomonas vaginalis. You should treat their partner as well. What is the treatment for trichomonas vaginalis? Well, that will be metronidazole for patient and their partner. And the question stem could also ask, what should these patients avoid while they're being treated with metronidazole? And the answer is they should avoid alcohol during the treatment. What is the most common cause of vaginal discharge? And that would be BV, bacterial vaginosis. Gray fishy, not itchy equals BV. On exam tip in the stem, look for clue cells and a positive VIF test, as this is our classical findings of BV. What diagnostic test is used for BV? And that would be the VIF test and the clue cells on the microscopy. Ask about odor on exam question. If you see that the VIF test is positive and you see clue cells on microscope, your diagnosis is BV. Cough prep shows hyphae. Which infection are you dealing with? And that would be Candida albicans. So the memory hook, yeast feast equals white beast. White beast for thick white cottage cheese discharge seen on the exam, and that should make you think of Candida albicans. What is the treatment for vulvovaginal candidiasis? That will be fluconazole. So the fluke fights the fungi foe. Single dose oral or topical therapy. Treat recurrent causes longer. So in the question stem, they're going to ask you, what's the best treatment? You're going to say fluconazole, and they're going to say this is recurrent, and then you should just say they should be treated a little bit longer. Painful genital ulcers cause. Well, that will be HSV. So the hertz equals herpes. If there's a genital ulcer that is hurting, you should think about herpes. Multiple vesicles plus prodrome confirmed with PCR. So painful genital ulcers are caused by herpes simplex virus. Painless genital ulcers cause, that would be syphilis. Soft pain equals chondroid, no pain, syphilis. On exam tip, you're going to look on the stem and it's going to tell you it's a single ulcer, and you're going to confirm it with RPR and VDRL. What is the treatment for primary syphilis? That would be penicillin G intramuscular. So penicillin G IM, P for penicillin, painless, positive RPR. If the ulcer is painless and it's positive RPR, you should think about syphilis, and the treatment is penicillin G IM. Allergic patients require desensitization if they are pregnant. So the question stem can tell you this patient is pregnant, they're having a painless ulcer with a positive RPR. How should we treat them? And the answer in that case is desensitization is required before administering penicillin G IM. What causes cervical cancers? Well, that will be persistent high risk HPV strains of 16 and 18. And I say 16 and 18 are sinister strains. Question often includes PEP or HPV testing scenarios, and they're going to ask you which strains are most likely the cause of the cervical cancer, and the answer is 16 and 18. Screening test for cervical dysplasia. That would be the PEP smear. So in the question stem, they're going to tell you you suspect cervical dysplasia and what's the next best test, and you're going to answer PEP smear. So PEP prevents problems. Know the age and frequent guidelines, as that may ask in the questions as well. Cervical cancer screening begins at what age? And that will be 21. So memory hook, 21, screen for fun. 21 is when people can start drinking. So cervical cancer screening, same time as you can start drinking, 21. Under 21 is rarely tested unless patient is immunocompromised. What is the most common cause of secondary amenorrhea? And that would be pregnancy. So memory hook, if there is no period in a patient, you should always check for baby first. Always rule out pregnancy before further workup. Hormones elevated in menopause. That would be FSH. On exam, look for FSH greater than 40 to support your diagnosis of menopause. Average age of menopause. They can list 4 different ages, and the answer is 51. Most common gynecological malignancy, and that would be the endometrial cancer. Inside lining most defining. Inside lining most defining gynecological malignancy, endometrial cancer. It's often associated with unopposed estrogen. Ovarian tumor causing estrogen excess and precocious puberty. That would be the granuloma cell tumor. Granulosa grows girls early. Presents with abnormal uterine bleeding. So the ovarian tumor causing estrogen excess and precocious puberty is granuloma cell tumor. Tumor marker for epithelial ovarian cancer. They're going to list 4 different markers, and they're going to ask you which one of these is associated with epithelial ovarian cancer, and the answer is CA-125, often used for monitoring and not for screening. Treatment for Rh incompatibility prevention. It is ROH immunoglobulin at 28 weeks and postpartum. So the memory hook, ROGAM before baby jam. Given to the Rh negative mother with the Rh positive baby. So in the answers, they can play with this. They can say Rh negative mother with Rh negative baby, Rh positive mother with Rh positive baby, and you should look for negative mom, positive baby to give him the ROGAM. And our last question, guys. First line treatment for postpartum depression are going to be SSRIs and psychotherapy. So for sad moms, start sertraline plus support. Screening occurs at 6 weeks postpartum. Avoid abrupt medication changes. SSRIs plus psychotherapy is the first line treatment for postpartum depression. Thank you guys for watching another video. And as always, if you have a friend or if you are going through OBGYN, check out the book as it will save you time and you'll score higher. And I'll see you guys in the next video. Good luck on your exam.